أنه من قتل نفسا بغير نفس أو فساد في الأرض فكأنما قتل الناس جميعا.
I really appreciate and welcome all distinguished guests to this very important occasion. The French Medical Institute for Mothers and Children, FMIC, the first ISO certified hospital and the first SafeCare certified healthcare institution in Afghanistan, has continued to serve the country and its people, deliver with quality and save lives. FMIC, representing a unique public-private partnership between the government of Afghanistan, the government of France, the Aga Khan Development Network, and the La Chaîne de l'Espoir, with the facility managed by the Aga Khan University, has become a true example of a continued institutional commitment and impactful collaboration. FMIC recognizes the important role quality plays in healthcare delivery and that quality and excellence are fundamental to any organization's success. The institution, therefore, has continued the efforts to bring consistency, effectiveness, and efficiency to its service delivery. The contribution of science and research is vital to ensure quality health services to the people and to draw attention to the existing and emerging health issues.
Ministry of Public Health Afghanistan congrats FMIC on arranging this conference for the 13th time. The theme for this year's conference is Innovation in Healthcare, Accessibility, Quality and Research, which will provide an opportunity for healthcare providers to share their knowledge and discuss issues around the topic. Conducting such an academic conference of an international standard is immense for medical researchers and practitioners in Afghanistan. Afghan doctors and nurses can feel a sense of pride that they do not have to leave the border of their country to participate in such a rich professional development opportunity as this one. The richness of this paper presented at the conference is something to make us proud. The Ministry of Public Health promotes medical education, clinical training, and promotion of educational standards and conducting of research, and I'm sure that these conferences will help foster these elements. PGME Ministry of Public Health is very happy to involve the PGME Ministry of Public Health faculties in the conferences in the last 2 years and the scientific committee evaluating the abstract and facilitating a session chairs. We know that Afghanistan health system has come a long way, and especially for last 2 years, there has been improvement in many of its services, both its rural and urban level. This is evident when we see the health system indicator have improved, especially related to the mother and child. In a challenging situation, institutions like FMIC have provided us hope that if we come together for a certain cause, we can achieve our set goals. In 17 years, FMIC has become a place in treatment of choice for the Afghan population. Your success speaks louder than words.
It's an honor to be here in front of you, so numerous. And when I see the quality of the scientific medical presentation, I realize the long way since 2006 with our partner from academia, from Afghan government, from French government, and from La Chaîne. This conference is also an opportunity to know each other better, to listen each other better. In a world in complete chaos, the FMIC became a real laboratory of this modern medicine, modern surgery, modern anesthesiology, where it's based on exchange and listening what is being done elsewhere. Can you imagine the number of international missions from Karachi, from France, from Great Britain, from all over Europe? It's a real asset and a specificity of FMIC. And I think that it allows us to improve and offer a better quality to the Afghan patient.
And I'm very delighted to be here today with you. The 13th of FMIC Annual Conference, International Scientific Conference. The theme of innovation, healthcare, accessibility, quality, and research are very, very important for us. For me, I'm a pediatrician, as Eric told you, graduate from the Necker Hospital in Paris, and as a medical director of the CDE, it's been 7 years since I left Kabul through Eric Chesson, the man of FMIC and Kabul in Chandelès, Paris. Even in France, even in Europe, everyone knows him. Not a week or a day without Eric talking to us about FMIC in Afghanistan and all our partners in France and Europe also. Today I'm in Kabul at the FMIC. For me, the dream come true. As a pediatrician, I can only be very impressed by the work and services offered by the FMIC, allowed to have to children and especially vulnerable children. This conference, organized by the FMIC, allowed to have an increased quality of care. I'm really impressed. I'm here to reach people, to know your needs, and help everyone.
On childhood immunizations, I must say Afghanistan had made tremendous progress. When I was on the Gavi board, we were very proud always of what had happened in Afghanistan in terms of increasing coverage. But as you can see here, for many of the essential early childhood vaccinations, over the last 5 to 7 years in particular, progress has slowed. So this, again, is a reflection of the kind of focus that is needed, not just on getting vaccines to everybody, but also to make sure that the gaps and the disparities in vaccine coverage are bridged. So this means essentially that when you look at full immunization coverage, we're looking at about a fifth to a third of children who do not have full immunization coverage, which is something that Afghanistan can readily try and achieve. And Gavi will support, I know that for sure, having worked with them closely. Afghanistan has done reasonably well right up to 2010-11 period on improving childhood diarrhea management and care seeking for respiratory infections, pneumonia management, but progress over the last few years has slowed. And these are data certainly from the multiple indicator cluster survey that we have recently, and could reflect both availability of commodities as well as workers and access to workers in those primary care facilities. Now, what about nutrition? Nutrition is my area of expertise, and as I said, my group did the National Nutrition Survey of Afghanistan in 2013, and I was very interested to see if there has been any change in recent years from the indicators that we had determined some 10 years ago. So if you look at nutrition and look at what has happened in Afghanistan, we were always very aware of the fact that acute childhood malnutrition seem to have a relationship with insecurity and conflict. So some 10 years ago, when I looked at it last, on this particular slide, these blue areas are pockets of battle-related deaths, so where conflict events were largely concentrated.
And the most important thing is our presenters and participants of the today who are going to try to share their scientific knowledge and their expertise, and also the people who will be participating and trying to learn today. The purpose of this conference, we used to have two different activities each year. One was a scientific conference, and once we used to do the quality convention. The difference between these two are quite obvious. The scientific conference are those researches which or case studies which are rare, or they are collecting the data from different and trying to create a new knowledge, or trying to create nurture the new our residents, and also create evidences to provide the evidence-based care. And also in the quality convention, what we do is we try to improve continuously every single process in a hospital, whether it is not only in the clinical area, but also how can improve the effectiveness of our supply chain management, how can we improve our housekeeping, how can we improve the quality of food, how we can, so it is an across the these projects. So this year we have around 100 abstracts for the quality convention, and out of that 49 are will be presented, and 51 are the postal presentations, which are outside. Whenever you will go in the break, you can witness those.
For this baby, we did 4-time sclerotherapy. And after 4-time sclerotherapy, one complication which is how can happen by alcohol, 98%. Maybe sometimes there will be a small necrosis. As you see in this area, she had a small necrosis, which by surgery we remodel, and we the child scar we removed, and after that she was completely okay. And also this girl, have you seen the venous malformation took all his face up to here and lower lip. For this child also we did 3-time sclerotherapy. 3-time sclerotherapy, and the complication of this case just was a small necrosis here, and maybe we did for future, just we do the mouth screen, mouth line, we can remove the this small necrotic issue and scar, and she will be completely well after that. As discussion, as you see, this is our paper which have published in clinical case report and accepted by experts. This kind of malformation is very challenging. When I was in Belgium, I see one cases which they did venous malformation, and they it was maybe 20 years before they did a surgery for that, which is in the venous malformation. Surgery is so much difficult. Maybe we take the patient to catastrophic.
So heartening. Each year we come to, this was the 13th scientific conference, that we continue to provide new learning in Afghanistan from our own folks out here, as well as from the community, bringing people together. And at the same time, quality convention, where we're looking at opportunities for improvement. And each one, you know, the competition part is there just to ensure that people get that extra edge. And you saw just now 31 posters presented, and the ones who got the award is only to encourage them, because at the end of the day, competitions do provide that stimulus where you come forward and do that extra.